today. We're going to get started in just a couple of minutes, but I wanted to take just a quick second to thank you again for being with us and give you an opportunity to ask any questions you may have. I say it a lot on this series, and perhaps this is the most important time or the most important point that we'll make throughout it. The questions that you have and the unique and individual challenges that may come up for you or for your school are really what make us a company and what keep us alive and keep us excited. So please feel free to share with us any questions or unique challenges that you may have on campus. Today our focus, of course, is AEDs and the program that goes around them and the infrastructure that's needed in order to truly implement a good and successful and sustainable AED program for your school. But oftentimes questions come up, and I shared with some folks that were on early with us that occasionally those questions are based on factual policy or program that's actually needed, and unfortunately occasionally those questions and challenges are also based on sort of myths and tales that may have been told or conjured up based on some information that somebody received at one point or another. So please feel free to share any questions, again, fact or fiction, with us, and we'll see if we can't get to the bottom of any myths that are out there today. And with that, let's go ahead and get started. So again, hello everyone, and thank you so much for being with us. We're excited to talk about AEDs and specifically the program and infrastructure that's in place and supports the AED program on your campus. Today I have with me Yedidya, who is one of our consultants in the Northeast. I'm excited to have him on the line with us. I'm excited for him to be able to share with you a variety of different components that go along with any AED program. As I shared, if you have any questions throughout the conversation today, please feel free to share those with us in the question panel on the right-hand side of your screen. My name's Chris. I'm the founder and CEO of Joffe Emergency Services, a school safety company, and a couple other things too, that started about 8 years ago with the goal of improving the safety and really the perception of safety and the conversation around safety for staff and faculty and for students alike. And we're excited to be able to be on this series with you. We are doing a webinar every Thursday at 10 a.m. Pacific, 1 p.m. Eastern. And each webinar dives into a different topic and sort of breaks apart some of the most common challenges and evaluates some of the successes that some schools have over others, and gives us an opportunity to share with you a number of things that we cover and work with on a day-to-day basis from the safety perspective. So again, thank you so much for being on the call with us. And with that, I'll go ahead and kick it over to Yedidya, and welcome, Yedidya.
Thank you, Chris, and thank you everyone who's participating with us today. It's a pleasure to have you. I'm really excited for this. Very quickly, this is me. My name is Yedidya. I'm by training, I'm an EMT, also a CPR instructor, and I've been doing that for about 6 years now. I'm also a safety consultant with Joffe Emergency Services. That's my main job. And just a bit more background, I got my bachelor's in science in a major called Health, Science, Society, and Policy. So I really like doing this emergency preparedness and try to have like a good idea of what policies are needed in place to do disaster planning and really make sure that we have an understanding of how to plan in advance and all of that stuff. Very quickly, what I want to try and accomplish today is so we understand why we need AEDs in our schools and what their use is really, and know what kind of rules surround AED use. And I'm going to preface right now, I'm not an attorney. I don't want to try to pretend like I can give you actual legal advice. I want you guys to have an awareness of what kind of rules we need to be aware of with our AEDs. And hopefully I'll give you some good starting ground to know what to investigate for your own schools, your own environments. I want to think about where we need to put our AEDs, how many we need, which is always one of the key questions that I get when talking about AEDs with the schools I work with. And I also want to talk a bit about good training, good planning, so that if and when there's an emergency, we know what to do and we're prepared for it. So what is an AEDs? It stands for Automated External Defibrillator. The way that I talk about AEDs in my CPR classes, the way the heart works is kind of like a toothpaste motion, going from top to bottom, and it squeezes out the blood in a nice coordinated fashion, and it does so very regularly. It does so your entire life, and it does so in that, again, coordinated fashion. There are times when a sick heart or a hurt heart can lose that nice coordination. So instead of pushing blood out in that nice toothpaste flow, everything just kind of squeezes at its own rate, at its own area. You lose that coordination, and eventually what happens is blood just stops going out because it needs that nice smooth motion in order to effectively pump blood. So when that happens, it can be a condition called ventricular fibrillation. You don't need to remember that word. VFib, also don't have to remember. It loses that nice coordination. What an AED does is it recognizes that condition, and it kind of stops everything and allows the heart to resume its nice toothpaste flow. And that's all it does. What AED is great for, though, is it's foolproof. You can't shock anyone who doesn't need it, and it will recognize when you need to shock. If you haven't taken an AED class, highly recommend it. Very easy. So AED can treat certain types of sudden cardiac arrest. What they always contain is that AED and the pads that go with it. Very often you will find little bags that have other materials in them that can help if there's need for CPR. Those usually contain gloves, pocket masks, scissors, razors, and towels, and those are kind of all accessories, adjuncts that help with the process of CPR and AED usage. For instance, the scissors are great for cutting people's shirts down the middle so that you can apply the pads directly on the skin. That's what an AED is. The question that we're trying to answer today is, are we required to have AEDs? And in terms of federal guidelines, the answer is really no. There aren't any federal guidelines that say all schools, all public buildings need to have an AED. There are 50 states, and there are 50 different rules about exactly what is needed in each state. I highly recommend this website that I have posted here, which was just chatted out, so you can have the URL there in your chat. This is when I was doing research for this, this website breaks down state by state exactly what kind of rules are needed. So I'll go look at one. So I live in Connecticut. I'm Connecticut-based, so this is Connecticut's, and it really breaks it down. Connecticut is really strict. Connecticut's one of the only states that require any higher education facility to have an AED, and it's really just in the athletic departments for the colleges, but in public schools, so elementary, middle, high school, all of those schools are required to have AEDs. And then you can also see other requirements about what kind of training is needed, whether you need to register, and the Good Samaritan Laws. So that is a super helpful resource, and I hope you guys make use of it. Google in general is a helpful resource. I was able to look up, I typed in Connecticut AED Laws, and I was able to find the actual statutes on what is needed for AED. So that's super helpful, and I really encourage you guys to do that. Make sure you have a firm understanding of what you have to be aware of. So there's no federal regulations about who needs to have an AED. And the end of the story is your students are generally not going to need an AED. There's an epidemiology study that was done to determine the risk of sudden cardiac arrest in young people, so people under the age of 35. and it was some complicated formula that basically said if you had 4,000 students who regularly attend school, you would have about one cardiac event every 100 years. So the AED is not really for your students because your students are generally going to be healthy. The AED is very often used for your adults who are on campus, your adults who come to campus for various reasons. So the AHA, the American Heart Association, they do have some guidelines for people who really need AEDs, and I personally think everyone should have an AED, but these are the top 3 that the AHA really says you need an AED. If you have people on your campus who have a known cardiac history, so I listed a few here, so just congenital heart disease, abnormal heart rhythms, long QT syndromes. Again, you don't need to know any of these terms that I'm throwing out here. I just want to give you an idea that there are people who have a known vulnerability to sudden cardiac arrest, and if you are aware of that, then that is something that you might want to prepare for specifically for that person or those persons. Another one is EMS call to shock interval is not reliably under 5 minutes, and what that means is if you were to call 911, how long would it take for them to get there and be able to administer a shock? So if you are right in the middle of the city, right next to the ambulance base, not you. If you are a bit more out there and unreliable response time, that is more what they're looking at. And then, again, the more people you have on campus, coming around campus, that's obviously going to increase your likelihood. And specifically, what kind of populations are coming. So if, I work in one school that is also a community center, and there are a lot of concerts that happen there and a lot of plays that happen there. And so during the day, it's a preschool or it's an elementary school. So that population, what's really the likelihood of that population having a sudden cardiac arrest? Well, when you consider that in the evenings, they have hundreds of people coming to their school building, and those people are generally going to be older, maybe older than 35, maybe older than 60, that will increase the likelihood of having a sudden cardiac arrest. So again, these are just some kind of guidelines to think about what is your need for an AED. Again, I firmly believe that every school, every public building should have an AED, but these are the big ones to really be mindful of. I also want to quickly get into the Good Samaritan Law. This is something that I hope you guys have heard about before. The Good Samaritan Law basically says someone who provides help in good faith and does not commit gross negligence is protected from civil liability. What this means is if you are helping someone and you're doing it in good faith, you're really trying to help them, and you're not doing something that's completely wrong, you're generally going to be protected from civil liability. And again, I'm not an attorney. I can't get into all the what-if situations, but in general, if you help someone to the best of your ability and you're really trying to help them, you will be protected from civil liability. This means that if you were to do CPR on someone and you break a rib, common occurrence. In fact, some people say if you break a rib during CPR, you're doing compressions right. So if you break a rib and they go around and they try to sue you, because you were acting in good faith and you were doing basically what is correct and you're not committing gross negligence, then you're going to be protected from that lawsuit. Some things to be aware of, though, with AEDs is who is covered by that law. The Good Samaritan Law is kind of a federal, you guys should do this, but really it's up to the state to determine exactly who is covered by the Good Samaritan Law. With AED coverage, this is something that really should be looked into because it varies by state who is covered. I believe in every state, the user is covered. So if you are the person who takes an AED and you use it and something happens, because you are the person providing aid, you're going to be covered. But different states have different coverages for the owner of the AED and the organization where that AED is placed. This is important because let's say at your school you had an AED. This is an example I've found online. But you took the batteries out of the AED because you were annoyed by the low battery beep that kept coming from the AED. You removed the batteries. Someone needed that AED. It wasn't available. You would probably not be covered by Good Samaritan because, first of all, that would be gross negligence. But also that would be a situation where it's not the user who is being looked at in the lawsuit, but it's the owner or the organization that is running the event in that area. So it's important to know that sometimes if you are the owner of an AED and something happens, you might not be covered. And again, this varies from state to state and scenario to scenario. So it's something that you should look into. And again, that website that was, now it's in the chat, really great resource, really good starting ground to investigate what your state laws are. There's a lot of additional laws that you should really be thinking about also. And again, this varies greatly by states. One of the first ones is reporting the acquisition, location, and type of AED. And this is usually letting your local EMS agency know, hey, we just purchased 2 AEDs. They are Philips FRX. They are going to be located, one in the cafeteria, one in the front hall. Now you know. And this is just so that the EMS agency is aware of what resources are around, and also so that they can have a plan for, if we get to this school, what should we expect to see? And again, you should just check. It's going to be a very quick check of what your state requires. How many people must be trained? I was looking at California's laws, and California has a law that for every AED you have, you must have at least one person who's trained in CPR and AED usage, up to 5. So for the first 5 AEDs you have, that would be 5 people, and then every additional 5 AEDs is one more person trained in their usage. If you as a school have more than 5 AEDs, bravo, I'm really impressed. Also, questions of internal notification and annual training. So a lot of states require that you make sure everyone is aware, including parents, including board members, making sure that they're aware of the acquisition of AEDs and also their locations. There's also a lot of annual training that is required. So CPR and AED generally last about 2 years, but there's also some places require annual brochures to be sent out to all staff, all parents, about the use of AEDs. And then finally, there are requirements for emergency plans. We'll get into that. So emergency plans, we've heard about them. We at Joffe talk about them all of the time. When states require emergency plans, they usually talk about emergency plans in 2 places. Your school absolutely needs to have a emergency plans document of what to do in various different emergencies. In that plan, in that document, there needs to be a provision for AED usage and what to do in the case of sudden cardiac arrest. A lot of places also require that there be some kind of guide, some kind of plan laid out that is located next to your AED. This generally includes the following: kind of call 911 or whatever your emergency number. So at my college, where I went, calling 911 would actually produce a 6-minute delay, whereas if you called the college EMS, we would get there within usually a minute and a half. So we had our emergency number posted next to the AED. Also tells you about initiating CPR and where AEDs are located. Also worth noting that when you call 911, 911 dispatcher can walk you through doing CPR. So that's also just something to think about. 911 is great. I want to show you quickly, this is an example from the Carey School, which is a school that Joffe has worked with. These are the emergency plans. So this is the page that appears in their full documents. and they have a really interesting approach to theirs. They have on one side what you would do if you were within the school, and another side of what you would do if you were anywhere else. Carey School has a population of about 250 students. They have 2 AEDs, which I think is great for them. And again, if you look at the procedure on the bottom left, recognize cardiac arrest, initiate CPR, send someone to call 911 AED, apply AED and follow its instructions, and then follow up with family notification. That's kind of exactly what I'm looking for, those steps. Again, once you call 911 and get the AED going, after that, all the instructions are provided. The AED talks you through what it needs, what you're doing. 911 will talk you through what you're doing, what you need. So those are really the main steps. If you do not already have the AED worked into your emergency plan document, definitely consider putting it in, and we can help you with that. So now we get to the question of how many should I have. So I want to quickly ask you guys in a poll, how many AEDs should you have on site? How many do you have on site? That's the poll right now. So I'm going to go open that poll right now. Maybe. Give me a second when I figure out how to do this. Here we go. Thank you. So again, how many AEDs do you have on your school? And we have a few options: none, 1 or 2, 3 or 4, 5, or more than 5. Okay, and it looks like we are good with this clip, so I'm going to close it. So right now we can see about half of you have no AEDs on site, and another half of you have 1 or 2. So that's interesting to see. So again, we were talking about this earlier. There's no hard and fast rule about how many AEDs you should have on site. There's no federal guidelines. I haven't seen any states that have a formula that you should use. So you really need to think about what are your needs, what are the needs at your school, and what will make your school safe. So what I was alluding to earlier about, it's not really the students who are going to need an AED. The one exception to that is during athletic events. There's a lot of different heart conditions that can either be caused or be aggravated during a athletic event. So think about that, and think about, you know, the school I was talking about where they had concerts at night. So even during the day they had about a population of 100 or 200, but during the evenings they could get up to 1,000. So think about your location, think about your needs. Another thing that we like to talk about is a 90-second retrieval. So 90 seconds from the point of, okay, something has happened and I need an AED, to when you can actually go and get that AED. So we want that time to be about 90 seconds because really an AED shock needs to happen quickly. We always talk about time is tissue, and every minute after the brain stops receiving oxygen, there's a 7 to 10% decrease in likelihood of return of spontaneous circulation. So when we talk about how close you need to be to an AED for it to really be effective, really help, we're talking about from the point you recognize the need of an AED to you are at that AED, 90 seconds. And that should be at a pretty brisk walk. We don't really sprint because that's just going to end up getting hurt. So think about your school, think about where you have AEDs or where you want to put AEDs, and think about, if something happened here, would I be able to get an AED in 90 seconds? And where should they go? Again, population density. One of the big ones is always athletic areas. So that's generally going to be, if your students are going to have a cardiac event, it's almost always going to be in athletic areas because your heart is getting stressed there. There's a variety of conditions that can happen. Athletic areas also get a high number of people spectating, so you will have a much larger population there. But think about, again, where do you have large venues? Where do you have people coming? Do you have a large auditorium or a large theater where people come from? Another one that I talk about is the front office. Generally speaking, when people come into the building, the first official desk they see, the first secretary, administrative assistant that they see, they associate that as a place to go for help. So that's a very good place to have a resource of an AED. Also, if an event happens right on your doorstep, your front office is going to need that. Another thing about the front office is if there is any event anywhere in the building, that generally gets funneled through the front office. A lot of emergency information flows into and out of the front office. So if the front office is notified that there's an event somewhere, they can send someone with that AED to wherever that is needed. Another thing is the demonstrated need. This goes a bit to what I was saying about if you have person or persons on your campus who have a cardiac history. Another example I have is at my college, we had an adult learning center. So the population of students in that building was about 3 or 4 times the average student age. So that was a place where we made sure that we had an AED available. Demonstrated need could also be if you have a history of things, of injuries happening there, of whatever, and that might be a place to think about having an AED. So the second poll that I'm going to do is what populations at your school are trained in CPR and AED usage? We'll start that poll. So again, what populations at your school are trained in CPR AED? And some populations are athletics, administrative staff, teachers, students, and others. So this actually looks like it's coded as pick one. So let's say pick the one who are all trained. All right, and that went pretty quickly. And we'll close this in just a second. And again, asking kind of which populations at your school are the most trained. So I'll go ahead and close this. So just looking at these really quickly, athletics staff and teachers, which are exactly kind of what I would expect to see. So again, we ask, what populations at your school are trained? And I realize also that this poll only allows you to select one option. So when I'm asked who needs to be trained in CPR and AED, I always answer as many people as possible. The science of CPR, basically, again, I already quoted this statistic, but every minute without oxygen decreases the likelihood of return of spontaneous circulation by 7 to 10% for each minute that's passed. So after 10 minutes of no CPR initiated, it's really almost impossible to get a pulse back. I think everyone in the entire world should be trained in CPR. And that's not just for your school, definitely in your school better, but I think also there's kind of a need for more CPR training in bystanders. So if you are out, in the street and you see someone passed out, I would love to see more people train CPR. In certain states where being CPR trained is part of getting a driver's license, their rates of out-of-hospital cardiac arrest resuscitation, their resuscitation rates are through the roof, and that brings them up to about 30%. And that is because everyone there is trained in CPR and AED. So I personally think that everyone needs to be certified. More realistically, in looking at the needs of what you guys are going to be asking for, who should be trained at my school, who should we prioritize? Obviously, if you have a campus healthcare provider, that person needs to be CPR certified. I would be kind of confused about any healthcare provider who didn't know CPR. But that's definitely your first priority. Your next priority is going to be athletics, and that's, again, what I've been saying all along is if a student is going to have a cardiac event, it's almost always going to happen during an athletic event. And again, you have a lot of people coming into athletic events, and they're going to be there, and the coach is going to be there, so it's really important for the coaches and any athletic staff to be trained. Next, I would say is administration staff, and that's, again, the front office staff. That's your administrators. Those are, if an emergency does happen, the information for that is going to go into and out of the front office, into and out of the administrative staff. So they're going to be the ones who are most likely to hear about an event, and they're also going to be dealing with the adult population probably a bit more than the teachers are. So that's, again, thinking about who's coming to your campus and who's going to suffer sudden cardiac arrest, and definitely teachers. And teachers, I think, for them, especially for their students, there might be a bit more of an emphasis on first aid training. When we at Joffe teach a class, we always include AED because it's so easy to do. So even if we were to do just a first aid class, we would do first aid and AED. And also, a lot of different states require that teachers are first aid, CPR, AED trained, so that's something to consider as well. I'd also like to consider doing student first aid, CPR, AED classes. They're pretty short. I've seen some schools where they stretch out to kind of a mini semester, so they'll do half the semester general health topics and half the semester first aid, CPR, AED. If not, a CPR first aid AED class can take between 6 and 8 hours. It's really easy to bang out in one day, and again, it will really improve the preparedness level of your school. It prepares them for the world. And again, it's not your students who are going to be suffering sudden cardiac arrest. It's generally going to be your adults, your teachers, for instance, are way more vulnerable to those kind of cardiac events than your students are. So that's something to consider. Some things about installing AEDs and really getting them together. A lot of places require physician oversight. AED is not something that you can just buy on Amazon and, all right, you've got it. A lot of places require a prescription and then also physician oversight. So if a cardiac event were to happen on campus, a physician looks at the AED, analyzes the readout, and makes sure that everything happens okay, provides quality assurance and improvement. When Joffe sells AEDs, we generally don't do the installation. We don't do the installation. We leave that up to you. One of the questions that I get is, why should we have an alarm on our AEDs? It just seems like an annoyance, and if the student opens the alarm, then it causes a loud beep. That's annoying. The alarms that are on AED cases, first of all, they usually turn off once the door is closed. The good reason why there is an alarm on AED, it's not a theft prevention, it's more of an alert of something is going on. So if I needed an AED because something happened, I could open that and people will hear that alarm and they'll say, oh, hey, someone's grabbing AED, maybe I should investigate, maybe I can help. That's why the alarms are there, and I think they're super important. And I really encourage everyone to make sure that their alarm is armed. Another thing to think about when installing AEDs are maintenance. AEDs are pretty self-sufficient, and if you just let your AED chill there, it's going to be pretty good. You do need to do monthly maintenance just to make sure that everything is going okay. They're pretty easy to do. When you get an AED, you'll be given guides to how to do that maintenance. Some of the things that can go bad really are the pads. The pads for the AED do have expiration dates. The batteries will eventually wear out. Those are things to look for. If you do get an AED, or for the AEDs that you have, you should think about how your maintenance is done, who's in charge of maintenance. I've also included here a link to a AED setup guide, and that will be available in the handouts. I think it's available right now. This is actually an outside resource that I came upon. It's by Physio Control, and we don't have any connection to Physio Control, but it was such a great guide that I really wanted you guys to be able to take a look at it. It goes through a lot of the steps that we've talked about, and we're going to pull it up now. Excellent. Really, like, making sure all these steps that I've talked about kind of goes over making sure you have physician oversight, making sure that you have an implementation team, and a lot of just general guides that you should think about. So if you have a chance, take a look at that handout. Really great. So take-home thoughts for you guys is why do we need AEDs? What are we preparing for with them? And why, again, your students don't need an AED probably, but as a public building, as a building where there are people coming in all the time, that's why we need AEDs. I want you guys to be aware of the different rules that are in play. So rules about Good Samaritan laws, good rules about how many people need to be trained, what your emergency plans need to look like, what kind of physician oversight you need. All those things are good things to be aware of. I want you guys to have an idea after our conversation of how many AEDs we need and where we need to put them. And again, there's no hard and fast rule, but I want you guys to think about all those kind of things and have an idea of the discussion of, okay, we need this many, this is where we're going to put it. I want you guys to also be aware of training and planning. They're just essential. You can't, a tool without the training, without the knowledge of how to use a tool can be a pretty useless tool. You guys need to make sure that you guys are up to date with your CPR and AED protocol. You need to be aware of making sure that people know what they're doing in an emergency. Also, I want to make you guys aware of a coupon that we got for you guys using the code back to school, so the number 2. 5% off of AED sales through us, through Joffe Emergency Services, during October. This is just a great perk, and I'm really happy to give it to you guys, and I hope you guys enjoyed this. As always, we school safety assessment email, just to make sure that you are on our list. And one too many. There is going to be a survey.
And Yedidya, I'll pause you for just a couple of seconds. There are a couple of questions that have come in, and some are some really good ones I want to make sure we get a chance to talk through. The first is, we mentioned that there's not a hard, fast rule for how many AEDs are supposed to be on campus. Is there a general best practice for the number of units on a given campus? And like Yedidya said, it really varies, and it depends on the amount of campus that you have, as well as your population. So the client that Yedidya was referencing earlier that has both an elementary school and a preschool, as well as sort of a public building that invites a little bit older population to come together on a regular basis, is going to need more than likely more AEDs on campus than a client that is, or a school that is just an elementary school. A school that has more students is more than likely going to be a little bit bigger, and for that reason will more than likely need a few more units. The strategy that I like to use when walking a school campus to try to figure out how many AEDs are really needed is that 90-second rule. So I'll walk out to any given spot on the campus, and I'll imagine there's an AED at the front desk or somewhere that's pretty commonly occupied. And when I say pretty commonly, I really mean always. And I'll think, well, from this point that I'm on campus, can I get there in 45 seconds and get back to the patient in 45 seconds at a brisk walk? And if the answer is no, then I probably need to put an AED there. And then if I walk to the farthest point for both of those, I sort of make a triangle. Well, can I get to either of the two AEDs now within 45 seconds and get back to my patient within another 45 seconds, keeping that total at 90? And if the answer is yes, then I've done all I need to do. If the answer is no again, then I probably need to look at another one. In general, schools have at least one AED, and that's the goal and sort of our mission really in working with our schools, is ensuring that there's at least one on campus that we can access. And it's okay to stage the growth with these. So if you don't have the budget for 10 AEDs, but you really need 10, that's okay. Go ahead and figure out how many you need, how we can best use the 1 or 2 that we can get this year, and start planning to get 2 or 3 more next year and 2 or 3 more the following. AEDs, along with any other emergency preparedness product, shouldn't be something that strains us financially or really challenges us financially, and they don't have to be, because it's bad. So great question. It looks like there was one other question that came in from Kelly. Oh, and the question was, it's the Good Samaritan Law. Really, I'm having a hard time reading this, but I believe that your question is, does the Good Samaritan Law apply in every state? And yes, indeed it does. What Yedidya mentioned earlier about the differences in the coverage or who might be covered by the Good Samaritan Law really refer to the Good Samaritan Law itself and how we interact with it. But there are also liability and coverage components that go along with your insurance program. So if you're, as the owner of the unit, for example, not covered under the Good Samaritan Law, that's okay. You may be covered under your own insurance policies, and that's something to take a look at. When AEDs first came out a few years ago, and I say a few, really a little bit more like 20 to 30, there was a lot of apprehension around whether or not schools should get AEDs, whether or not public places should get AEDs, and believe it or not, some insurance companies actually intentionally wrote into their policies that schools and businesses and public places shouldn't acquire AEDs because they were afraid of the liability. And that sort of thought and process has very much changed. In fact, at this point, every insurance company that we're aware of pushes and recommends at least a couple of AEDs on any given campus, or one if the campus is small enough that that's all you need. However, the idea and the thought that people
should be afraid of the liability that goes along with the AEDs to stay in place. And so when we start talking about the Samaritan Law and the insurance regulations and protocols that go around having an AED, occasionally that old thought will come back up. And I think that, Kelly, that probably was a little bit more than you're looking for, but if that can answer your question, please feel free to share that. And Yedidya, I'll go ahead and turn it back over to you.
Thank you, Chris, and thank you guys for the wonderful questions. Just want to show you guys quick these 3 email addresses. For any questions during any of these webinars, schools@Joffe Emergency Services is where you should send questions. You can send those now. You can send them a month from now, and we'll try and answer them. I want to give you my contact information. So this is my email address here, Yedidya BA, so YEDIDYABA @Joffe Emergency Services. I also just wanted to include Josh's email. Josh is one of our sales rep. If you have any questions about purchasing AEDs using that awesome coupon code, that is there for you. And finally, thank you guys again for joining us today. It was a pleasure having all of you. Pleasure getting to talk to you about this important topic. Here's our website. As always, there's a survey here to express your thoughts, express how you felt things were going. So thank you again, and I look forward to speaking with you again in a future webinar.